and then I record my audio separately. So if you are ready, in 3, 2, 1. Hi, everyone. Welcome to Sandy K Nutrition, Health and Lifestyle Queen. Today with me, my special guest is Dr. Michael Turner. And Dr. Turner is a graduate of Stanford University, Harvard Medical School, and the Mayo Clinic, and has treated over 10,000 patients since 2009. He practices integrative medicine in his own national concierge practice, providing personalized approaches, including hormones, sleep, recovery, nutrition, supplements, and exercise, and more, to really help people achieve their optimal state of health. He brings a high degree of empathy, trademark optimism, and a holistic approach to patient care. He is also the host of the Manna podcast and has over 13,000 active subscribers to his blog on Substack. Dr. Turner is also a member of the Frontline COVID-19 Critical Care Alliance, so the FLCCC. And today our discussion is all about the spike protein in COVID, in the vaccines. We're going to talk about long COVID. We're just going to really break down what we know now, what we know. What is it? Just over 2 years since the vaccine was introduced, and over 3 years since the pandemic really began. So we have a lot of, I guess we have some data now. We have about 3 years of data now, and it's a great time to have a discussion. And with that, I want to welcome you, Dr. Turner. Thank you so much for coming to talk to me today.
Yes, you're welcome. That's very kind of you. Glad to be here. Thank you, Sandy.
So I have to ask first about your story, because you have a very traditional training in medicine and you turned to more of an integrative approach. So talk to me about your story and how this all transpired.
Yeah, well, my story goes back actually to my childhood, and it started off with some very strong roots of integrative medicine, health, and wellness. My mom, for example, was a hippie in the 60s, actually went to University of California, Berkeley, went to protests, had speeches with Dr. Martin Luther King, the whole thing.
Wow.
And she worked in a natural health food store during college. So I was the first child. And when I came along, it was all about healthy living emphasis. There was minimal TV, no video games. She never bought me a video game system in my entire childhood. I whined and complained through a fit. Didn't matter. Never got one. Minimal sugar. We couldn't have any sugar cereals. Every other kid would have all these junky, amazing sugar cereals, right? And in my house, it was like grape nuts, whole wheat flakes of different things. The most sugary cereal I could ever have was Honey Nut Cheerios. That was it. That was like my treat. There's a famous story of me with my obsession about Twinkies. Basically, I could never have Twinkies, right? And so I'd go to school, and my lunch would have grapes for my treat. And Johnny, neighbor kid, would have Twinkies, in his lunch for treat. His mom gave him a Twinkie. And so I started to obsess about Twinkies because I could just never have them, and I'd occasionally sneak little bites from friends and stuff. Anyway, one day I got caught in the grocery store. I got loose in the Twinkie aisle, and I just couldn't contain myself, and I was tearing into this box. My mom came and found me, drug me out front. I had to apologize to the store manager, the whole thing. So point being, though, I had some really strong roots of wellness, health, and such in the way I was raised, and I'm really thankful to her for that. So when I went to medical school, I went to Harvard. It was great training, of course, fairly traditional, but still progressive in many ways. They had a nutrition class, for example. They had you seeing patients pretty much from day one. They had a class called Living with a Life-Threatening Illness, in which you had to shadow someone who had a terminal diagnosis. My patient was a woman in her late 30s who had terminal breast cancer. She was an immigrant from Russia, had a family, young kids. I had to follow her around to different medical appointments, ask her questions about how she was doing, what was her experience with the medical system, that kind of thing. Fascinating, very, very insightful. Wow. Yeah. While I was at Harvard, I was a bit of an anomaly. I was a little bit strange because I was a guy who, for example, I would have a Ziploc bag full of all my vitamins and supplements, and I'd have it tucked into my scrubs pocket. Okay, so I'm at the hospital, I'm on break, and I'm pulling vitamins out of my Ziploc bag, right? Or I'm at the hospital on break and I'm doing yoga in the break room. Or I'm going to the natural food store and I'm making smoothies and I'm doing hot yoga after class and things like that. So I was seen as a little bit far out. I'm from California, so I think they kind of put me in that zone, you know, mentally. So fast forward then, after I finished all my training, I had a bit of a crisis of purpose in my career. So I was hired to work in a neuroscience center here in Washington State, was doing that, enjoying it in large part, but I had such an emphasis on wellness, on health, on vitamins, on checking people's hormones, talking about sleep, talking about stress, you know, biofeedback, positive mental attitude, making smoothies, intermittent fasting, infrared sauna, like all of this stuff that is extremely potent for health and wellness. My interest was so great in that I essentially outgrew the role for which they hired me. I was going far afield with patients into these other areas. And so the hospital and I mutually parted ways amiably in 2020. I went into business for myself and I said, you know what? Life is too short. I'm not going to live my career thinking about coulda, woulda, shoulda. Okay. I'm going to bring my best vision of patient care to reality. This is like my work of art, my statue of David. You know, I'm going to give it my all and bring my best vision out there. And it's an integrative vision. It's a holistic vision centered on wellness, prevention, education, some of the things that you mentioned earlier in the intro. And so there we are today.
It's beautiful. That's a beautiful thing, because I always say that optimizing your wellness is always best using a multifaceted approach. You know, we need Western medicine, but I also feel like we need to incorporate a holistic lifestyle as well, right? We need it all. We kind of need it all. Okay.
Yeah.
So I love what you do. And that's why when we connected, I thought, who better to speak with than a medical doctor who is trained in all facets of wellness than you about COVID. And it's been a while. It's been 3 years. I mean, I think a month ago, almost a month ago a month, it was in March of 2020 when the whole world kind of shut down, right?
Right. Yep.
And we really didn't know a lot. There was a ton of fear, and now we know quite a bit. And you have a lot of information to share with us today. And I think people really need to understand, because this spike protein, spike protein is thrown around a lot, but a lot of people don't understand RNA. They don't understand what spike protein is. They don't understand the difference between the spike protein that you have from the vaccine versus from the virus. Because don't you get, isn't the virus, isn't it spike in the virus too? So we need to understand it all. We need a reframe, Dr. Turner. And I'm going to hand over the mic to you, because I think you can probably explain it very clearly for all of us.
Oh, sure. Thank you, Sandy. Well, yes. Let's start in this manner.
Okay.
Let's talk about the virus and the spike protein. What is the spike protein on the virus? If you look up a picture on the internet of COVID spike protein, it'll show you some spherical representation of the virus capsule. And then you'll see, usually colored in red, right? These little things that look like grappling hooks hanging off of this thing. Okay. Those grappling hooks are the spike protein. This binds to a certain receptor, which we've identified, called the ACE2 receptor.
Yeah.
We know where this thing binds. We also know what the ACE2 receptor does, which that's been well characterized for decades. We can talk about that later, but this thing binds to the ACE2 receptor. And then that's its entry point into the cell. It worms its way into the cell through this receptor. Now, when the vaccine was developed, the thought process was, we don't want to infect the person, obviously, with the whole active pathogenic COVID virus. let's just give them a piece of the thing and let their body respond to a piece of this, let their immune system be exposed to just a sliver of this whole virus, and then let their immune system create antibodies to that. Now, the idea of an antibody, I want you to think about a glove and a hand, okay? If the hand is the foreign particle that's coming into your body that your immune system recognizes as foreign, it doesn't want that hand reaching around and being active and doing things. It creates something that has a literal three-dimensional shape that slides right on top of it, thus inactivating it, aka the glove. Okay. So that glove that your immune system creates as it is exposed to anything, for example, if you had chickenpox when you were a kid, or the flu virus from last season, whatever, your immune system is seeing parts of it, and it's creating antibodies, aka gloves, that go and three-dimensionally bind key parts of whatever you were exposed to, thus inactivating it. And also, when your antibodies bind to it, they target it for destruction by your immune system. I want you to think of it like a red signal flare, okay, in an emergency scene or in a soldier war movie or something, right? So when this glove binds onto whatever's foreign, it then lights off a signal flare on the back side of it, which signals to the rest of your immune system, hey, I just found something foreign. I'm targeting it for destruction. Please come in here and destroy this thing. Okay, which is exactly what happens. So with the vaccine, they were thinking, we don't want to give the whole COVID virus kit and caboodle. Let's just give them a part. Let's just expose the body to the spike protein, for example, because then if the immune system created antibodies to the spike protein, you would have high levels of these circulating. And the first time it saw a real COVID infection, all those antibodies will quickly swarm the spike protein on the little COVID virus capsules and prevent it from entering your cells.
Right.
Sound good?
Yep.
Okay. Here's the $1 million plot twist, the $10 million plot twist in this whole thing. The spike protein is not just the way that COVID enters your cell. It's a way that COVID causes problems. In fact, it's the main way that COVID causes problems. COVID is not just a problem because it's a thing that gets in your cell. It's a problem mainly because it's got these spike proteins all over the surface, which are very toxic to our bodies and elicit a strong immune response targeting them for destruction. So when we introduce spike protein from the vaccine, we have essentially introduced the worst part of the COVID virus. They picked the wrong target. We've inflicted on people the worst part of the COVID virus and a thing that creates a strong immune response. Therefore, if I had spike protein, for example, it being produced in one of my heart muscle cells, I am now attracting an immune response to that same heart muscle cell, and I am destroying that heart muscle cell, aka myocarditis.
Right. That's huge.
Yep. Yes. So the vaccine creates production of spike protein through mRNA. Right?
Yes.
So in your listeners' minds, you could think, oh, maybe the vaccine just pumps a bunch of spike protein in you, like 10,000 units of spike protein, and then lets that circulate. I mean, it could have. Certain viruses traditionally are like that, or rather certain vaccines are, but that's not how this works. This inserts into your body instructions to turn any given cell that it contacts into a spike protein factory. Okay, so if the vaccine successfully gets in my heart muscle, it sends a signal to my heart muscle cell to start creating a bunch of spike protein. It becomes a spike protein factory. It then puts these spike proteins up on the cell surface and thinking that the cell's thinking this is a normal part of function because I have this genetic instructions to do so. It's putting it out on the surface of the cell like any other protein, as if it were normal and helpful, but it's not. So now I've got my normal heart muscle cell coated and filled up with spike protein because it had an mRNA instructions inserted into it to do so. And then we've got all the problems that I just mentioned. So we can talk a little bit more in detail. There's plenty more to talk about, but I just want to leave it there for questions and feedback.
Yeah, I have a question. So
yeah,
because this is probably the biggest question. We
Yeah.
have this. Okay. I have listened to so much and read so much research, but I'm not a
Yeah.
doctor. So, and most of the
Yeah.
people who are going to be listening to this are not doctors. So it's not that easy to comprehend. And this is probably the biggest question. Why do some people have issues and some don't? Like with the spike protein, right? Why do some get the
Yeah.
myocarditis and some don't? And did you say spike? It's throughout that we have, is it ACE2 or the spike protein? Does it go through the whole body? Or I just want to clarify that aspect, because you see so much variance. You see some people who have no response. You see some people who end up in the hospital with myocarditis. Like, it's really confusing.
Mhm. Yeah. Good point. Let's talk about that. A couple of great questions you raised. First of all, where does the spike protein go?
Yeah.
We'll call it the distribution. Let's talk about distribution. There
Yes.
is a huge difference between a natural SARS-CoV-2 infection and a vaccine in terms of distribution. A huge difference, and this is important.
Okay.
If you get a COVID infection, how does it get into your body? The answer is airborne, so it hits your nose or your mouth. That's how it gets in your body. So now that COVID virus is sitting there with its spike protein on the surface. You have X number of virus particles now sitting in your nose or your throat. Your immune system's mounting a response to them. Those little spike proteins are very toxic. They're noxious. They're stimulating immune response. Fair enough. We've got swelling in our throat. We've got swelling in our nose. Now, if our immune system is strong enough, it'll come destroy all the COVID particles that it finds. And our natural normal cells in the mucosa of our nose or our mouth are not expressing spike protein, right? They're not infected. The non-infective cells are sitting there normal, but the ones that have been infected by COVID are now.
Okay, Dr. Turner, are you talking about an individual normal response that is vaccinated or not vaccinated here?
Good point. It doesn't matter, but let's just say for clarity and simplicity, someone who's not vaccinated.
Okay.
Yeah. So I'm saying that when anybody has a COVID infection, the spike protein is going to first, initially be found in the areas of that infection, aka the nose and throat, right? You're not going to have, if you have a COVID infection, you're not going to all of a sudden have spike protein in your heart muscle. You're not going to have it in your biceps muscle. You're not going to have it in your, lung tissue. It's going to be in your nose and throat initially, unless the COVID virus, right, point of entry, exactly. And it's possible that your body mops up that infection and then it's eradicated and gone. And that spike protein never got to your brain, to your heart, to your kidneys, to your ovaries, to your testicles, etc. Make sense?
Yes, it does.
In contrast, the vaccine spike protein goes multiple places in your body, multiple places instantaneously, pretty much.
Okay.
Again, this is a plot twist. When the vaccine came out, they told us, oh, we just give you this shot in your shoulder. And the idea was it's going to only stay in your shoulder.
Yep.
And it's granted, it's going to turn all your normal deltoid muscle cells into spike protein factories, and they're going to be targeted for destruction by your immune system. That's why it's going to be swollen and painful. Okay, but that's just a local reaction for the greater good of having an immune response. We'll sacrifice a few shoulder muscle cells as spike protein factories in order to launch a strong antibody response. Fair enough. That was the thought. However, that was a lie. And Pfizer knew ahead of time through some data from a Japanese animal study that they tried to cover up. People had to go find this data, that when they injected the rats and then killed the rats, I don't know, several days later, whatever the time point was, and then they looked for so-called volume of distribution of the spike protein, right? Where did they find the spike protein in these rats? Was it just at the site of injection? No, ma'am. It was in multiple places. They isolated spike protein in the adrenal glands, in the ovaries, in multiple locations in these rats. Okay. Let's fast forward to human studies. They've done lymph node biopsies. Okay. People who have had vaccines, let's say in my shoulder muscle, they can biopsy lymph nodes nearby this region, and they find spike protein in those lymph nodes, meaning it got into your lymph system. If it gets into your lymph system, that's contiguous with your blood system. That can travel anywhere.
And how
Okay.
long after
So
did they find them, Dr. Turner? Like how long after that, like that vaccination did they find in the lymph node? Did they say?
yeah, let me refresh my memory on that. Let me look it up actually real quick for you. But it was
I'm
this
just
particular
wondering
study
how long it
was
sat there, right?
right, right. So the particular study I'm talking about was 2 months. It was 2 months after vaccine,
Okay.
and scientists did lymph nodes biopsies and successfully identified spike protein and the viral or mRNA particles as well.
Okay.
Yeah. Beyond that, there have been some other studies shown that you can still have the presence of spike protein for months afterwards, months, either from the vaccine or in the case of a COVID infection, aka long COVID. So let's talk about long COVID for a second. One way of thinking of that is part of the defining characteristic is the presence of spike protein.
Okay.
Okay. So there was a study done where they looked at people who recovered from COVID and people who developed long COVID. And then they did special imaging techniques to try to determine who had spike protein present and who did not. Everybody who successfully recovered from COVID, aka did not develop long COVID, when we checked for spike protein, they didn't see it. Okay, it was cleared. Everybody who had long COVID, when they checked for spike protein, they saw it. And this study was done about 13 months out. That was done at Harvard, one of those hospitals there in Boston area. So we know that in long COVID, that spike protein persists at least 13 months afterwards. And that's considered, therefore, part of the definition of long COVID. In other words, if spike persists, you're going to have long COVID. If it doesn't, that's the same thing as getting over it.
Okay.
Well, let's just ask the question, what if you gave someone a vaccine and a booster, 2-3 times a year? You're putting them in that same concept. You're putting them under constant exposure to ongoing spike protein.
Okay. So
Yeah.
question, because I'm always
Yeah.
going to like, do we know why? So first off, I'm going to ask, what are actual symptoms? Because it's not like I'm going to go and get tested and see, okay, I'll give you an example. Here's a great example.
Yeah.
I was double vaccinated initially. Here in Toronto, it was mandated. We couldn't even go to a restaurant, right? So I had the first 2 vaccinations.
Yeah.
Then I ended up getting COVID well past a year past the second vaccination.
Yeah.
I didn't go and get the booster. Okay. I
Right.
got COVID. My husband and I had it at the same time. He had barely any symptoms. He was barely sick. He was just tired. I got the full-fledged, flu for 3 days. And then I coughed very severely for 8 weeks after. Is that long COVID?
Getting close to it. Yeah. The typical definition of long COVID is 12 weeks. So if someone's still symptomatic from their COVID after 12 weeks, we're going to call it long COVID.
Okay. See, I started taking matters into my own hands and started, and by the way, we're not giving anyone medical advice here. I'm just going to do my little disclaimer right now. This is a discussion and it is simply for educational purposes. So I need to make sure that I put that out there. But what I did was I started taking high doses of N-acetylcysteine and poof,
Good.
cough went away. So, okay, this is so interesting. Okay, so long COVID definition is 12 weeks past initial infection. What would you classify as symptoms of long COVID? Because not everyone's going to go and get tested and see where is that spike protein in the body, right?
Sure. The typical symptoms of long COVID would be cognitive impairment. We'll use the word brain fog. That's a nice descriptive phrase, right? People feel the sense of brain fog, word finding difficulties, can't remember things, not feeling sharp at work. Secondarily, I would say it would be low energy. So they're fatigued, feeling tired in the afternoons, no energy to work out at the gym. In extreme cases, hard to get out of bed, that kind of thing. Headaches are common. Of course, persistence of loss of sense of taste or smell is common. And then certain people, unfortunately, would struggle with ongoing chest pains, irregular heart rhythms. I've dealt with a number of those situations. So those would be some of the top presenting symptoms.
Okay. Now, why do some people end up having, do we even know this yet? Do we even know why some would end up having that spike protein go somewhere else in the body, or I guess stay in the body and present long COVID symptoms, and some don't? Do we know why?
I don't think we know all the reasons. Just obviously it's a new disease. And also I was at a national meeting of the FLCCC, Frontline COVID Critical Care Alliance. This was in Orlando. The whole entire topic, the description of the whole meeting was spike protein diseases, AKA COVID, SARS-CoV-2, and the vaccine. And so it was all about spike protein. It was phenomenal, and I'm just mentioning that because in one of the podium presentations, the chief medical officer with FLCCC named Dr. Paul Merrick said from the podium, he said, I've been an ICU doctor for 30 years, very eminent researcher, very good career. And he says, this is the most complicated medical infection problem we've ever seen. He says, by comparison, this makes HIV look simple. That was exactly what he said. That hit me. Yes, he said, by comparison, this makes HIV look simple, right? That was heavy hitting. Yeah, that was heavy hitting. So that contextualizes things a little bit. But back to your question, why do some people persist into long COVID and others don't? I would say, couple answers to that. One is just the general strength of your immune system. Okay, so the more robust your immune system is, the quicker you're able to clean up the infection from this COVID, right? Which carries with it its spike proteins on the surface of every virus particle. The quicker the spike proteins, therefore, gone from your body. So this would be similar to, do you have basically a healthy immune system? Are you a person that's down for the count, quickly and for long periods of time with seasonal flus, colds, that type of thing? Or are you one of these people who, I haven't gotten sick in a year or two, I can't even remember the last time, something like that. So strength of the immune system, hugely important. Also, there are genetics related to your endothelium, we'll call it resiliency of your endothelium. What is the endothelium? It's the innermost lining of your blood vessels. And it's actually very thin. It's just one cell thick. So I want you to think about it like a tube. That's your blood vessel. And on the inner lining of this tube, you have a layer of plastic wrap or saran wrap, right?
Yeah.
On the inner side. That's what it is. It's very thin. It's a delicate inner surface of your blood vessels, supremely important. This is where signaling, for example, happens to tell that blood vessel to relax or to constrict. That's a molecule called nitric oxide, which is released by the endothelium of your blood vessels. Now, some people have, based on genetics, robust, resilient endothelium versus susceptible. And when we have the spike protein floating through our bloodstream, we have it landing on these cells in the endothelium and immediately causing inflammation, immediately causing a big immune reaction, immediately causing inflammation, swelling, right? Some people's endothelium is able to withstand that better than others. Let's just understand, let me expand on that point for a second. There are some nasty things that the spike protein does, whether from the natural COVID virus or from the spike protein. Okay, or from the vaccine. It immediately, number one, it promotes blood clotting. The spike protein hugely promotes blood clotting. This is why if someone has COVID, I recommend they start an aspirin, 325 milligrams right away. I also recommend they use something called nattokinase, which is a natural blood thinner. So the spike protein, wherever it goes, promotes blood clots very extraordinarily. It does this in several ways. It causes the platelets to clump together. So you have these little fragments of cells called platelets that are involved in the blood clotting cascade. It causes them to clump. Number two, it signals to the immune system, come and destroy me. Well, if your spike protein's hanging off one of your endothelial cells, come and destroy me means that endothelial cell is destroyed. So you get inflammation and damage to the endothelium, which also would tend towards blood clotting. And finally, the spike protein damages the ability of that endothelium to release nitric oxide, which is that signaling molecule for dilation, for opening up. So now you have constriction in your blood vessels. They don't dilate as well. So you can imagine with platelets clumping, with inflammatory damage to the endothelium, and with now the endothelium being impaired in its ability to create dilation of the blood vessel, you have a very pro-blood clotting scenario. And if you get a blood clot in your heart, this is the definition of a heart attack, right? In your brain, it's the definition of a stroke. In your leg, that's a so-called DVT, deep vein thrombosis. And even if you don't have a full-on blood clot, if you have sluggish flow through that area, you will get, for example, chest pains with exertion. You will get fatigued easily because you're simply not getting the blood flow, which brings the oxygen delivery to your cells that they need to create energy. So spike protein damages blood clots hugely. Let me just go on real quick, give you an overview, and you can talk about any of these other ones. The second thing we have to understand is that it directly destroys cell membranes. Okay, it directly damages and destroys cell membranes. Your cell, again, think of it as a sphere. It's three-dimensional. It's not exactly a sphere, but big three-dimensional object there. And it's got a layer of molecules on the edge that define the border of the cell. Stands to reason. Something's got to define the border of this thing. We call that the cell membrane. The spike protein, if it touches the cell membrane, it pokes holes in it. Okay. And that is from this, the spike protein gets cleaved. So not to get too technical and geeky, but the spike protein gets cleaved and it releases something called the S1 subunit. If you want to look this up, the S1 subunit of the spike protein, again, whether from the vaccine or the COVID virus immaterial, the S1 subunit directly pokes holes in cell membranes and destroys them. Okay. And this is particularly important in barrier function. So there are certain barriers that your body has set up, certain cell junctions that we want to be very tight. We do not want easy movement across certain barriers. For example, there's something called the blood-brain barrier.
Yes.
All right. Correct. You probably have heard of that, right?
Yeah. Oh, yeah.
The blood-brain barrier. Yeah, that's to protect us. That's very selective. And the idea is we don't want any possible toxin floating through your body to just easily diffuse up into your brain and cause damage. So we're going to be very selective and protective, and we will create a blood-brain barrier. Fair enough. The blood-brain barrier is composed of very tight junctions between the epithelial cells of the endothelium there of the blood vessels as they interact with your brain. So if those cell membranes and cell junctions are destroyed by the S1 subunit, we now have permeability of the blood-brain barrier. That's a very negative concept. Now things are able to freely, it's like someone broke down the gates to the city. Now people are, the marauders are just flowing in and pillaging. Okay. Wow. So, yeah. So promotes blood clotting, destroys cell membranes and cell junctions. I'll just mention two other things real quick.
Can I ask you before you continue? Is this where myocarditis would come into play as well with these cell membranes?
No? It would be more of the first thing where I talked about inflammation. So that, think of it like a splinter.
Of the lining of the heart, right? That's what myocarditis. Yes.
Correct. If this gets loose, so when it's in your bloodstream, we've got the endothelial lining, that little saran wrap, plastic wrap layer, that thing's getting inflamed. Okay. If it breaches that barrier and gets out into whatever cells nearby, such as a heart muscle cell,
right?
Okay, and it starts in the COVID virus, for example, infects your heart muscle cell, then spike protein is released in that area. Your immune system will be attracted to that area and it will start destroying the spike protein, but collateral damage, it destroys everything else nearby. All right. So if we have spike protein loose in our heart muscle cell, it's our own immune system that is then causing the main problem. It's attracting, it's trying to destroy the spike protein and clean up the mess, but there's collateral damage, aka inflammation of the heart muscle cell, aka myocarditis. So the myocarditis happens,
I'm going to have to come I don't want to keep, because I'm like this. I just have so many questions, but I know you were
Sure.
finishing a thought, but I do want to come back to the myocarditis because I know you were
Yeah.
finishing your other point. So I want to let you continue. Sorry, I had to ask about the myocarditis, and I do want to ask something else once you finish. I do apologize
Oh,
for cutting you
certainly.
off there.
Let's focus on that. Yeah, no problem. Let's focus on that. I'll just mention one other thing. We talked about
Yeah.
blood clotting. We talked about directly destroying cell membranes. The other thing is abnormal heart rhythms. Okay, the spike protein will directly predispose to abnormal heart rhythms because the junctions between the heart muscle cells are disturbed. Remember I said pore forming toxin pokes holes in cell membranes and cell junctions. The junctions between the heart muscle fibers are disturbed, which is going to promote abnormal heart rhythm. Also, the ACE2 receptors that the spike protein binds to, they have a role in heart rhythm. And so if you have a bunch of these ACE2 receptors getting stimulated, we'll call it overstimulation of the ACE2 receptors. That will cause abnormal heart rhythms and therefore possible sudden cardiac death.
Whoa.
Yes, this would be a reason why people get vaccinated and then die suddenly, because that spike protein can do exactly what I just said and throw them into abnormal heart rhythm.
Whoa. That's major.
Yeah.
Okay.
Okay.
Are you done that one
I'm
section?
done. That was my
Okay.
train of thought. My train of thought there. Yeah.
That's okay. I love it because now I have many questions to just tie into that. So
Yeah.
here's where I don't understand. You talked about a little bit about the genetics with the that's the lining of
Yes.
the
Yes. The
lining of the
endothelium.
arteries or the endothelium.
Yes.
Okay.
Yes.
Why do we see certain patterns in age or sex groups? For example, 20-year-old males, myocarditis. Have they made any connection? You know how they were like young males, not 20, but young males and myocarditis.
Yeah.
Do we know why yet? Or is that still unknown? There was actually a warning about that, remember?
Right. Oh, hugely. Absolutely. Yes. I'm not sure we all understand the whys and the wherefores of that, but we know that it is a fact. Somehow the young males in particular, when exposed to spike protein, end up with a risk of myocarditis that's much higher than females or than older people. Yeah.
So we don't know why.
As far as I'm aware, we don't have that answer. And I'm always learning, and there's new information coming out every week, so I'm open to suggestions and understanding there, but I've never heard of a specific physiologic reason why the young guys would develop myocarditis and other people wouldn't.
So if you have a stronger cell line, like if you have strong, because I've heard a lot of experts talk about phospholipids or cell barrier, cell lining. So would that make sense that if you have stronger barrier lining, whatever you want to call it, phospholipids to your cells, then you would be better off than somebody who doesn't? Because this is something that we don't know.
Yeah.
Like,
theoretically, that would make sense. That would make sense in as much as the S1 subunit of the spike protein pokes holes in cell membranes.
Right.
If you could tell me, hey, this is how you get your cell membranes stronger, or this is why certain people have stronger cell membranes than others, then that would hold water theoretically to be more resilient.
I've just heard with certain protocols, if you take phosphatidylserine or choline, then it strengthens the cellular wall. So I'm just throwing this out there because, I hear a lot from a lot of different practitioners. Now, I have to ask about long-term issues. So, we talked about the spike protein staying in the body for, a couple months that we know for sure in some people. What about long-term? Have there been any studies of people who just, I hear this, that, I've never been the same ever since I had the vaccine. Now, that's a pretty subjective statement because we don't know
Yeah.
why.
Well, we can say why. Actually, we know that the vaccine produces some long-term changes in our body that are
Oh,
negative.
yeah.
So,
Let's hear it.
oh yeah, absolutely. We can talk about that. But yeah, so if someone says, I've never been the same since the vaccine, there's credible reasons to understand why that might be so. Yeah, that's not just all in their head. Let's just say. So for example, we'll talk about certain cell lines. All right. So you have certain immune cells, which we probably have heard of, called T cells.
Yep.
And to be very specific, yep, you have something called your CD8 T cells. Okay. We know that the vaccine causes a reduction in CD8 T cell count. That is very negative. That is very negative. CD8 T cells have a role, for example, in cancer prevention. So if
Oh,
you are taking down someone's CD8 T cell levels, that's the same thing as putting them at increased risk for cancer.
wow.
Okay. It also lowers something called type 1 interferon, INTERFERON, type 1 interferon. Again, type 1 interferon, very involved in cancer surveillance, prevention. If you reduce levels of type 1 interferon, you are interfering, let's just say, with your body's defenses against cancer. You're at increased cancer risk. Okay. We know that it reprograms the immune system in certain ways that are negative, that predispose to autoimmune conditions. So there are documented numbers of cases of people's autoimmune problems that were previously well controlled, that sort of had the lid taken off and came out of retirement to become very, very active and problematic. Because it negatively affects your immune system, also, you can have so-called reactivation of previously dormant infections. I'll use example of hepatitis. I had an in-law whose hepatitis was well controlled. They were on some antiviral medication, no big deal, got the vaccine. At some point afterwards, the hepatitis flared up and has been difficult to control ever since. Or you can have reactivation of Epstein-Barr infection, EBV. People have heard of that, right? Oftentimes, if it's unchecked, can cause chronic fatigue. People will say, my EBV was fine, my chronic fatigue was fine, I got the vaccine, it came back. Yeah, so so-called reactivation of latent infections is definitely a concept. Those are some of the big ideas there, I would say. Yeah.
Yeah, I find it really interesting because I actually heard that very statement just yesterday, and it was from my father,
Okay.
who's going to be 86. And he said, ever
Yeah.
since, I've never been the same, because he suffers with arthritis. And he said, it's just gotten unbearable. It was always manageable before, and now it's not. So I'm always curious, but so just so that I can understand this,
Yeah.
the reason, so spike overall is really toxic. Whether
Yes.
it's from the vaccine or getting COVID, it's toxic.
Yeah.
The difference with the vaccine versus getting COVID is we know with the vaccine, it doesn't stay in the shoulder. The spike doesn't stay localized. Whereas
Yes.
when we get the virus, there is always the risk of even getting COVID and getting long COVID, even if you're unvaccinated, for the spike to travel elsewhere. There's still the risk either way. The difference is now we know that the vaccine kind of makes it travel everywhere. Does that make sense?
Yes.
I'm trying to put it into layman's terms here.
You got it. You got it. Yes. And
What
I'll say one other thing.
Okay.
Yeah, just to expand on that point.
Yeah.
Another reason why the vaccine induced spike protein is arguably worse than a natural COVID infection has to do with how they engineered the mRNA. Okay. So if they had done appropriate studies on this, they would have said, hey, after a vaccination at 6 weeks, 8 weeks, 10 weeks, how much spike protein burden do we see in someone's body? Okay. And then compare that to after a COVID infection at the same time points. How much spike protein do we see? Those studies have never been done. We cannot make direct comparisons. But arguably, for the reason I'm about to mention, we'll call it the spike protein burden. Arguably, the spike protein burden is much worse after a vaccine than a natural infection. I'm not talking about distribution. I'm just talking about quantity of spike protein produced as well. So it's two ways that can work. And the reason is this mRNA strand, which is basically a set of genetic instructions that get dropped into your body, spread everywhere, as we said, enter your cells, and then tell your cells to do something. This mRNA strand has been bioengineered. It is not a typical normal mRNA strand. It's been bioengineered to be super potent and to resist degradation by your body. It's been engineered to be super potent and super resistant to being eradicated. Now, the idea was we want to have a potent vaccine. We don't want to give someone an mRNA vaccine and have their body tear up the mRNA and dispense with it in 2 or 3 days or something. We want the mRNA to persist for a while so we can get a strong immune response. Okay, this was the logic. So in their minds, that was helping the vaccine be effective. The fact that it was engineered to resist degradation and to evade the immune system. And we essentially believe, if we were to throw a rough number on it, we're thinking that it's probably produces about 1,000 times more spike protein than a COVID natural mRNA strand would give instructions to the cell. Okay, it's a bit of a guess, but it's arguably much worse because it was intended to be potent in that way.
And very powerful. That makes sense.
Yeah.
Thank you for clarifying that.
Mm-hmm.
Okay. Michael, I pressed pause. Okay. Let's continue on. Now, I think it's really cool to mention at this point is that Dr. Turner was an educator. This is why this conversation is so great, because he is able to bridge the gap from medical perspective, which is sometimes hard to understand, to all of us here who are like, what's the right thing? And then you yourself, who's listening, can make the informed decision, because Dr. Turner used to be a teacher. I love that. So this is why you're so great at explaining all of this for us.
Thank you. Yes, Sandy, I enjoyed it very much, my time as a classroom teacher prior to med school. And then when I interact with clients, I think of it the same way. I have an educator hat on, and I'm thinking, I want to download to their brain the essential ideas here. I want them to understand it like I do, because if they did, they would be as capable, as empowered, as motivated to take care of themselves and solve this problem as I am. So I'm always thinking of it in terms of information transfer and in terms of inspiration towards change and
beautiful
self-care.
Thank you. Okay, so
sure.
I want to ask a question, because now the big thing that everyone's talking about is getting the bivalent, right?
Yeah.
It's the vaccine that it's still an mRNA vaccine, correct? The bivalent? It is, right?
Yes.
Okay,
Yes.
so here's a question, because this is something that I have heard. I have heard that this should be taken if you have any kind of medical condition that could cause you to have worse COVID symptoms, and that it can prevent long COVID.
Mm-hmm. Mm-hmm. I can't comment on whether and to what degree it might prevent long COVID.
Okay.
I'm open to further investigation, doing the research, looking into things thoroughly at that point. I can't comment on that.
Okay.
The idea of the bivalent is basically to solve a major problem that the original vaccines had. Okay, which was they had not been updated since the original Wuhan strain emerged from China.
Right.
Right. So if you can imagine, they've got the original Wuhan strain in 2020. They use mRNA to create the spike protein from that thing. And so your body is creating an antibody response. Remember the hand and glove analogy. It's creating an antibody glove to the original Wuhan spike protein. But guess what? That thing is not around anymore. You can't find it. It's gone. We're on generation 4.0 now, and this was generation 1.0. So we're giving a vaccine that was outmoded. This would be equivalent of saying, how excited would you be to get a vaccine for the flu season from 4 years ago? Okay.
Yeah.
How likely is that to be helpful? Right. How likely is it to be helpful? Let's just ask the question. And, you know, how excited would we be to promote that thing? So the problem with the vaccine approach to solving this epidemic in the first place, there are many problems, but one of them is obvious that the vaccine cannot keep up with the rate of mutation of the virus. The virus is always going to be several steps ahead. So by the time they do the R&D, ramp up production, supply chain, blah, blah, yada, yada, they're already way behind what the actual virus is that you're seeing in your community, which is why the vaccine was losing its efficacy, because it was creating protection against something that didn't exist anymore, only shared some similarities with the current strains, but the strains are changing. And in particular, if they change in the structure of the spike protein, right, then the vaccine inducing a glove antibody response to the original spike protein, those antibodies aren't really fitting well on the new mutated forms of the spike protein. So there's less efficacy of the vaccine. So their thought was, we got to update this vaccine. And that's essentially what the bivalent vaccine is. It's updated. We got a piece of the original Wuhan spike protein, and then they updated it with an Omicron variant as well to try to bring it up to present day, which makes sense. I'm not going to necessarily argue with that from their perspective. Right. It's updating the vaccine. So that's good. You know, it's still got problems that I mentioned, but that's the idea. At least it brings a little more towards the current circulating form of spike protein that your patient is likely to encounter.
Okay. And here's a question. I don't know if you can answer that, or maybe it goes back to the whole immune system thing, and it might go back to the genetics thing. Why do some people get COVID like all the time? It's like they've got COVID like every year, or not even every year, every 6 months even.
Yeah.
And then some will have it once, and it's like a one and done.
Yeah. Good question. We're still trying to understand that. I would say, as a general rule, the idea of the strength of your immune system is hugely important there. So, for example, let's say I have a COVID infection and my immune system is very strong. It's very robust. It puts out, 10x the amount of antibodies that a normal person might put out, right? Then I've got 10x higher level of antibodies floating around, persisting for months, probably even over a year, to that COVID virus if I see it again. On the other hand, what if I'm a smoker and I get poor sleep and I'm stressed all the time and I eat a lot of sugar? Okay, I'm going to have a weak immune system. When I see the COVID virus, I produce a piddling little antibody response, 1x. Okay, and that slowly starts to wane over time. So when I see a new COVID virus, it quickly overwhelms my defenses and starts to reinfect my body. So the robustness of the antibody response that an individual can mount is a huge determinant. This would go generally under the category of how healthy is your immune system. Part of that's genetics, but a huge part's lifestyle, and a huge part is supplements. I'm such a big fan of supplements because they can directly modulate your immune system. Just to give you one of my best examples, there's a mushroom called Agaricus, Agaricus, Agaricus blazei merrill, big old name. We'll call it the ABM mushroom. The ABM mushroom is known to modulate the immune system in very helpful ways. It directly stimulates numbers and activity of certain key immune cells in your body, including things called natural killer cells. ABM mushroom was discovered in Brazil by some Japanese researchers. The Japanese have been investigating medicinal mushrooms for a long time. And it's actually a very well-developed science in Japan. From what I understand, they use mushroom extracts as chemotherapy for cancer. They use it in, the hospitals. It's very well-developed and systematized. So the Japanese were always looking for new and better mushroom varieties. They somehow got the idea in the rainforest down in Brazil somewhere that this thing was growing. And so they actually found this community of people who were abnormally healthy. And they started to investigate, and they said, well, we've got these mushrooms that grow out in the forest here. We harvest these things. We've been eating these things for, years and decades. And they called it the mushroom of God. No joke. The locals called this thing the mushroom of God because they were convinced it was pretty healthy. So the Japanese took a sample of this thing, went back, put it in their labs, checked how active it was. Turned out it was like 3 to 4 times as active as their best mushroom they had found so far. Okay. So the ABM mushroom is like top of the list now for immune stimulation. Here's the beauty of this. You can get this thing on Amazon for probably $14 a month. Okay. You can get a nice bottle of ABM mushroom extract. And I'll just even say the brand, Swanson. So if you look up Swanson, 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 they're a very reputable supplement company that also sells them at quite a good value. And if you type in agaricus, AGARICUS, agaricus mushroom Swanson, it's literally available for $14 on Amazon for a month's supply. It's amazing. So strength immune response, big deal.
I love your education and your knowledge because listen, I call myself a supplement junkie, as you can see behind me. I believe in therapeutic grade supplements, and I know a lot about supplements, and I've never heard of that mushroom. So there you go. I love that you mentioned that. So, and I also like how you mentioned, modulating the immune system. It's not really about boosting it, right? Because overstimulating the immune system also isn't great, right?
True. That is true. That also gets into some problems sometimes with the vaccine in the sense that they can make subsequent COVID infections worse. So that goes under the tagline antibody dependent enhancement, but that is a phenomenon. There have been many studies where you look at the severity and the incidence of COVID in the unvaccinated population. And then after they roll out the vaccines, 80-90% uptake, what happens? You would expect the COVID infection rate to go down. It doesn't, it goes up, and the severity goes up as well. Okay. Meaning somehow this thing is changing the immune system in a way that's making subsequent infections worse. And sometimes if the immune system is overstimulated, that's a bad concept. For example, let's use the idea of the heart muscle. If a COVID infection gets loose, or the spike protein from a virus or from the vaccine gets loose into my heart muscle, that spike protein is recognized as toxic. It's going to be targeted for destruction by the immune system. Immune system cells are going to sweep in there, macrophages, monocytes, other types of destructive cells, and they're going to destroy that spike protein and whatever is next to it. Now, if that's a heart muscle cell, that's a problem. What do we want? Do we want 1,000 immune cells to swoop in, or do we want 10,000 immune cells to swoop in? Do we want 100,000, right? The more heavy hitters we bring in with the immune system, the more collateral damage and intensity that is. So in a perfect world, right? In a perfect world, you want just enough immune response to eradicate the problem, but you don't want an over exuberant immune response to do a bunch of collateral damage, nor do you want that immune response to persist, right? You want it to be fired up, switch goes on, infection gone, switch goes off. If it persists, you have the definition of an autoimmune problem. Your immune system is continued ramped up as if there were a live infection, and there's no live infection, but it didn't get the memo. Okay. And it's still destroying things and creating antibodies and stuff. That would be an autoimmune problem.
Right. Now, here's a question. What about the other vaccines? There's other ones. There's the Johnson and Johnson. There was, the one
AstraZeneca.
Is that the one? The one, like, I can't even remember. Yeah. There were like 4 big players, really. There was the J&J, the one from the UK, and then the 2 mRNA ones, right? What about the other ones that are not using mRNA? Were they more traditional? Do they have less of that spike potentially going all over the body issue?
Great question. So there are basically 2 categories of vaccines. There are the mRNA vaccines, and then there's only one other one that's not, and that would be Novavax, if you've heard of Novavax.
Yes, I have. Okay. Yes.
Yep. So Novavax is over here in its own category. Everything else is over here. Pfizer,
Oh,
J&J, Moderna, AstraZeneca, all that stuff. Okay. So those are they're introducing mRNA strands, which tell your cells to produce spike protein, basically turning them into spike protein factories, etc. Novavax is different. It's a little more traditional. It introduces preformed spike protein into your body. Okay. So kind of like a COVID infection is bringing spike protein into your body. Novavax also brings spike protein into your body, but at lower quantities, theoretically, than the other ones. And it doesn't involve genetic reprogramming of your natural cells. It's just sprinkling some spike protein in your body, ideally, from their viewpoint, enough spike protein to mount a sufficient immune response so that you get antibodies and subsequent protection. So it is more of a traditional vaccine in that sense.
okay. That makes sense. It's funny because when I was trying to understand all the different ones, I do know that the Novavax was the one that was the most traditional, but I still understood J&J to be separate from, I don't even know the names of these anymore.
Moderna and Pfizer.
And then Moderna, I saw that one as the one that had the most powerful amount of spike. So I did so much research on this, however long, over 2 years ago. Now, here's a question. What is more powerful in the sense that it helps your immune system getting the virus or getting the vaccine? Because I have also heard that when you get sick yourself, you go through it. I got COVID, then it's going to make antibodies better than anything that's, false, like a vaccine.
Correct. You are right. This would be the question of so-called natural immunity versus vaccine-induced immunity, is what you're asking. Which one is better? We know this. This is a settled issue of science. It's been settled for probably over a year now. Natural immunity is better. And I'll just explain the reason. It's very logical. It's pretty simple. In the vaccine, you're only exposed to one part of the COVID virus, aka the spike protein. So when you create an immune response, your immune system's only responding to the spike protein. You have one type of antibody, let's just say simplistically, right? You have one class of antibody that's produced to one thing, aka the spike protein. Certain level of protection there, granted. On the other hand, when you're exposed to the COVID virus, that thing has a lot of different proteins involved. There are a lot of different parts of that virus molecule, or structure rather, so that as your body is destroying the COVID virus particle and looking at all the different pieces, it's creating multiple different kinds of antibodies to multiple targets on that virus. It is thus more multi-pronged, multifaceted, and more robust, because even if the spike protein changes, as it does from original strain to Omicron, for example, maybe other parts of the virus aren't changing so much. And so your natural immunity clues in from multiple angles, and some parts are more unchanging and constant. And therefore, your natural immunity is going to be more helpful than if you just hung your hat entirely on the spike protein, which is what the vaccines do. If that thing changes, your vaccine efficacy drops right off.
That makes sense. Yeah.
Yeah.
Okay. Why do they recommend that anyone who has any kind of health concern to get the vaccine? Why is that the recommendation? If we know that it basically can produce the spike throughout the whole body and cause inflammation through the whole body, maybe potentially worse than COVID.
Right. The idea comes down to a risk-benefit calculation. You could think about it in the population at large. They're thinking, what if we had benefit from the vaccine for our sickest subgroup of our population? Okay, although it causes problems, it does create antibody response to the spike. That can be helpful. So our sickest population segment is at risk. We want to therefore encourage them to go get this vaccine, and maybe even a little more broadly, other people around them, et cetera, so we keep them safe. So from a population viewpoint, there's some logic there. But on the individual viewpoint, it starts to break down. If we ask on an individual viewpoint, depending on what demographic you're in, okay, if you're an 18-year-old male, right, what's your risk of the vaccine to get a serious problem versus your risk from a natural COVID infection to get a serious problem? If you're a 50-year-old female, what's your risk from the vaccine to develop a serious problem versus a COVID infection to develop a serious problem, right? Etc. For most demographics, the balance is not favorable for the vaccine. And to give them the benefit of the doubt, we didn't know this all at first. We're now dealing with hindsight, more data, more numbers. Okay. But at this point, we know it. The risk benefit ratio only starts to kind of equilibrate when I think it's age 75 or 80, something like that. Okay. So north of age 80, yeah, the vaccine starts to have some benefit. COVID is potentially causing more hospitalizations and death than the vaccine would. It's therefore favorable on the individual level. So that slice of demographic, or maybe other subgroups where people are, younger than 80, but essentially have so many medical problems, they've got an 80-year-old body, let's just say for simplicity, right? That would be also possibly a risk benefit logic there.
Okay. That makes sense. Now, we covered off a lot in this last hour, but I cannot let you go. Can't let you go, Dr. Turner. Not until we talk about, first off, you need to know what can you do to protect yourself. I'm going to give you an example. So here, we actually had no choice during the first round of vaccinations. My son plays varsity sports. He wouldn't have been able to play if he didn't get the 2 vaccinations. He had to have both. And as you know, I'm a bit of a supplement junkie. So I'm like, oh my God, I'm hearing this about these young 20-something-year-old men getting myocarditis. So of course, I was actually giving him, I'm a big fan of peptide bioregulators. These are, they come from animal. So I was giving him blood vessel. I was giving him heart. I was giving him coenzyme Q10. I was giving him all this stuff more as proactive. When I knew he had to get the vaccine, I'm like, okay, we're going to get you set up. We have no choice, even though there's so much we don't know. And I'm going to say this, I'm not an anti-vaxxer at all. I am just I need to be equipped with the knowledge to understand what this does. And just like what you said, what's the benefit to risk, right? So let's finish off the conversation by talking, and again, not medical advice. You can talk to your own practitioner about this, but what are some of the things that, the FLCCC recommends that you can just really stay healthy?
Yeah, absolutely. I'll give you some heavy hitters. So let's talk about, let's talk about 5 things that directly bind the spike protein. So if you've had a recent COVID infection or a recent vaccination and you want to bind and therefore inactivate the spike protein, there are certain substances that we know directly bind the spike protein. Number 1, NAC. Okay, NAC, NAC. You talked about using that earlier. It's awesome. Directly binds spike protein. Also, potent antioxidant, potent anti-inflammatory, is very, very good for brain fog, headaches. Extraordinary. So I usually crank up the dose, minimum 600 milligrams twice a day. It can go up from that, even up to 1,200 twice a day in the case of a severe brain fog. So NAC binds spike protein. Vitamin C also binds spike protein. Okay, I recommend 1,000 milligram extended release formulation twice a day. 1,000 milligrams is kind of a robust amount, and you're likely to get an overshoot into your bloodstream and then urinary loss. But if you do an extended release, it more slowly and manageably trickles into your system. So 1,000 milligram extended release.
Can I ask you, what do you think? Because I was doing liposomal. What do you think of liposomal?
There's some logic to that. Yeah, I think that can be good. Yeah, I
Okay.
mean, there's some absolute logic and benefit to the liposomal delivery system absorption. There have been
Okay.
some, depending on what company we're talking about, right? But I've remember looking at some data from a company that showed that their liposomal was getting the blood levels as equivalent to IV vitamin C infusions.
Wow.
So
That's
yes,
really good.
yes, that's a fact.
Okay.
Yeah, so that was impressive. So vitamin C, and then number 3, a molecule called quercetin, a supplement called quercetin, if you've not heard of that, or perhaps, yep, Quercetin, 250 milligrams twice a day. Quercetin directly binds spike protein. It's very structurally similar to vitamin C. They're both present in citrus fruits. They would be categorized as so-called citrus bioflavonoids in the nutritional realm. So quercetin and vitamin C, and then NAC, we talked about that. Number 4, nattokinase. Nattokinase is amazing. I think you may have heard, a little bit about this. It's an enzyme, right? And it comes from fermented soy. So there's a fermented soy product called natto, Natto, which has been consumed in the Far East, especially in Japan, for centuries, purported to have health benefits. Turns out it does have health benefits. And in particular, there's this enzyme, nattokinase, that does some extraordinarily important things for your body. In fact, I will say, if you only can take one thing, the single most important thing to avoid a serious complication from COVID or vaccine is nattokinase. Because
you can buy it like that though? But
you can buy it like that. You can go on Amazon and type in nattokinase, Nattokinase, and find it. You can go on my website and find my best brand recommendation in terms of value. I'm not saying you have to, that's not a sales pitch, but I pulled together my best nattokinase recommendation for cost, value, potency, quality, supplier, etc. Because when you go on Amazon, it's a bit of the Wild West out there. It's a little confusing sometimes to find something that's good.
Oh yeah.
But yeah, my point is nattokinase is amazing. It directly dissolves spike protein. It dissolves it. That's one of the things that nattokinase does. It dissolves different sorts of proteins, directly dissolves spike protein. By the way, directly dissolves blood clots.
Oh.
Okay. Directly dissolves blood clots. In fact, it's used over in Japan, to my understanding, as stroke treatment. Okay, because it has so-called clot busting activity that's very potent, similar to medications, actually.
Wow.
So nattokinase is going to dissolve that spike protein. It's going to dissolve any incipient blood clots. And it also thins the blood to a degree, functioning kind of like an aspirin. So it's going down that lining of your blood vessels, that delicate inner lining, that endothelium, and is doing everything healthy that we'd want to have happen.
Nice.
Destroying spike, right? Destroying spike, thinning things out, and busting up any clots that are there. So nattokinase, the typical over-the-counter pill is going to have 2,000 FU, which stands for fibrinolytic units, 2,000 FU. You can take that, that's fine. I typically go up from that. I actually do 6,000. Again, this is a little subjective, but there was a study that came out of China that actually talked about atherosclerosis. This was prior to COVID, nothing to do with COVID. But we knew that nattokinase was healthy for the vascular system for a long time. And they actually did carotid artery ultrasounds, and they quantified the amount of atherosclerosis, AKA hardening of the arteries, that was present in people's carotid arteries. Then they gave them 6,000 units of nattokinase, and they followed up with them a couple months later. The nattokinase actually had started to reverse the atherosclerosis. I think it was 30% or so reduction in the actual imaging width of hardening of the arteries in these people's carotid arteries. Okay, that's pretty striking. So that's my big plug there for nattokinase. The fifth thing is the medication ivermectin. This is one reason that ivermectin is amazing. It works in at least 4 different ways, very potently against COVID, but one of them is that it directly binds the spike protein.
Okay, yeah, everyone's heard of ivermectin, and they really demonized it in the media. But I have some here.
Good.
That's
Absolutely. I
because I
prescribed
am
it.
who I am.
I prescribed it a lot. I'm not saying it's the end all be all magic bullet for COVID, but it's very, very helpful. If I had to give it a letter grade, old school elementary school grades and all that, I give it like a B+, or an A-. B+, A-. It's a solid. Yeah.
Okay. Here's a question. All of these things, we were talking about binding spike, right?
Yeah.
Whether it's from the vaccination or from getting COVID. Does
Yeah.
this make the vaccine ineffective then if you take it? If you take any of these things?
Good point. Yes, it would be. It's going to lessen the efficacy of the vaccine because the vaccine is based around creating a bunch of spike protein to ideally develop a big immune response. If you're reducing the amount of spike protein produced, yes, you're going to be getting less of an immune response to that vaccination. Right.
Okay.
So I would say from the medical decision-making side, you have to figure out the risk-benefit ratio for you, okay, based on your age, your comorbidities, et cetera. If you could theoretically benefit from the vaccine, then you shouldn't do any of the things we just talked about to bind spike protein because you're also hampering the vaccine. On the other hand, if you're a young 18-year-old male like your son, where the individual risk benefit is not favorable and he has this vaccine forced upon him for socio-political reasons, get rid of that spike protein ASAP with all 5 of those things, heavy hitters for a week, I would say, after the vaccine, something like that.
Yeah.
Mhm.
Okay. This has just been an incredible and such an informative recording. I love it. You have to tell us where we can find you, how you work with your patients, and then also where we can find out more information specific to the FLCCC.
Yeah, okay, sure. So FLCCC stands for the Frontline COVID Critical Care Alliance. They're easily available there on the web. I think it's flccc.net or something, but don't quote me there. Just look up FLCCC. The beauty of this organization, and by the way, I'm not on staff with them. I'm not getting paid to say this. This is an unbiased professional opinion. The beauty of this organization is, number one, their dedication to science and research and their dedication to being patient-centered. So they're not bought and owned by a vaccine company. There are not politicians telling them what to do. This is a group of independent medical scientists, PhDs, MDs, practicing doctors coming together and saying, let's publish best practices about how to treat COVID. It's
Love
the
it.
Wikipedia of treating COVID, essentially. And they've been doing this and they update it every few months. They keep it fresh. And they now have a multiplicity of protocols. They have long COVID, acute COVID, post-vaccine, et cetera. These protocols are amazing. These things save lives. I use them extensively as a foundation when I work with patients. I've seen them work. Now, as far as getting in touch with me, how I work, there would be 2 ways. If you're really quite keen on talking with me directly, we can do that. That would be through my website. So it's www.michaelturnermd.com. So MICHAELTURNERMD.com. You'll find me there. I work remotely 90% of the time. So I have clients from Germany, Australia, India, Israel, okay, as well as all parts of North, South America. So we can figure this out. We work with Zoom or a phone call, either way. In particular, patients appreciate talking to me because of the holistic approach, but also I directly talk about vaccine side effects. You know, so many patients go, I know something's wrong. I'm not the same after this vaccine, but I go to my local doctor and he doesn't understand it or doesn't want to acknowledge it or says it's maybe in my head. I know something's physically wrong. Yeah, there is. The spike protein is nothing good for you. And I'll tell you the truth and I'll be honest and acknowledge your problem, but also give you hope and tell you there are ways to solve this problem, but you can't solve what nobody's acknowledging, right? So people find it sort of very liberating to actually have a doctor listen to them about what they thought were their vaccines concerns, which are actually very legitimate. The other thing is long COVID. So I do a tremendous amount of long COVID, which can be successfully treated. I want to put out a note of optimism and hope there. So many people have long COVID. Unfortunately, they're struggling. They're thinking, I can't get better. You know, I have these chest pains every so often. I go to the ER. They tell me nothing's wrong. I feel good for a while. Then I crash. I go to the primary care. He checks some labs. They're all looking normal. He kind of scratches his head. You know, I go back home. I still can't work full time. I can't take care of my kids. I could repeat this story, you know, 1,000 variations, right?
Yeah.
And these people are suffering out there, feeling very isolated, not getting answers, not feeling encouraged, all over the internet, trying to figure some things out, right? We come to me, we can figure this out. We'll put it up and wrap it up in a nice package for you. And I'll tell you exactly what supplements, what medications we need to do, et cetera, to get you better. There is hope. We'll just work that FLCCC protocol, plus some things that I add in based on my own experience and research. And it can be very successful. There's absolutely hope for that. Aside from working with me personally, if people want to stay in touch, a way to do that would be through my Substack channel. So that is drturner, drturner.substack.com. That's where you'll find all my podcast guest episodes like this one, and also research articles that I write, blog articles that I write. It's all pulled together on Substack. So people kind of like that. It allows them to stay in touch from a distance, for example, and kind of pump up that self-education piece, which I'm a big fan of, as I mentioned, having done classroom teaching. So that's my education outlet, essentially.
You are an absolute wealth of information and such a joy to talk to. Thank you so much for your time today, Dr. Turner. It's been a pleasure.
Thank you, Sandy. Indeed, I really enjoyed it, and I'm confident that what you're doing here is going to reach thousands of people and help them with some very actionable information. So thank you for getting the word out.
Thank you.
Yeah.
Okay, I pressed stop on the just on the audio. Hold on, let me just stop the